For example, you've placed an implant and you don't like how it's placed, but you're done, and then you have patients on the schedule you need to go see. So the temptation is to just let your patient go and then pray about it at home. But fixing it right then and there is going to be so much more important than anything you can do.
Joining me today is someone I've had on the podcast previously, but today's a little bit different because most conversations around implants focus on how to place them, but very few ever break down how the best clinicians actually think before they ever touch a handpiece. Dr. Ivan Chicchon. Ivan, how's it going?
It's going great. Thanks, man. You kind of hyping me up here.
No, awesome. So you're the founder of Implant Ninja. Real quick, break down for us in a nutshell what that is.
Implant Ninja aspires to make implants simple, and we do that through trainings, and that's like courses, books, and office solutions. We try to demystify implants for people. Implants were really complicated for me going through school and trying to get into implants, and so we aim to remove that barrier.
Nice. Okay. So today, if we can, dive into like the decision making and pattern recognition and maybe what separates someone who places implants from someone who rarely makes mistakes doing it, if that's okay.
Absolutely. Yeah.
Awesome.
Happy to answer those questions.
Let's think of it this way. What's something you see dentists doing every day in implant cases that makes you think this case is already going to fail?
I think rushing. Rushing is the number one thing. So general dentistry is structured in a way that it's like a machine, right? You're jumping in and out of operatories. You're seeing multiple patients at once. And then once you start doing implants, you just kind of throw the implant patient into that mix. And that's sort of a recipe for disaster. Implant patients require a different workflow, a different setup, a different level of sterility. So you have to make sure to approach those in a totally different way.
Gotcha. Interesting. So rushing would be the main.
Yep, absolutely rushing.
What does that look like to you when you're like, he's like rushing in the sense of you see him making a lot of maybe mishaps, but not mistakes yet?
Rushing to me looks like you're in the chair and you're in the middle of doing your preparations and the patient is feeling some pain. One of your assistants says there's a hygiene check in room 1 and that the patient in room 5 needs a filling and they've been waiting for 20 minutes. And so your decision making is compromised. Mm-hmm. You're just going to get it done. And I think that's the most dangerous thing.
Gotcha. Your decision-making is compromised. That's really good. So then what's the difference between a dentist who knows implants and one who actually thinks like an implant surgeon?
I think that in order to improve upon that, in order to take that initial situation and completely rectify it, like the whole 180, is a practice that gives implants the importance that it should have. That if you have an implant patient, your assistants already know exactly how to set up for it. And it's like a different setup protocol, right? You want to make sure everything's clean. You want to make sure you have clean gloves, that, no one's touching stuff that they shouldn't be, and that they block time for you, that they block 45 minutes to an hour, depending on your experience level. I think making sure to give it the importance that it needs and setting a time block where you're not having to be in multiple chairs at one time. When I'm doing implant surgery, I don't jump around chairs. Right? When I'm in there, I'm not going to leave. The assistants might leave. So I have 2 assistants helping me during implant surgery, and maybe one assistant might leave to do something if I'm running behind, but I won't leave the room.
Okay, interesting. So then if you had to diagnose, like let's just say you're watching your members or your students, right? And you're not trying to diagnose them clinically, but mentally, what are the red flags and how they approach the case?
Yeah, so it's 2 things. One of the factors is confidence. So when someone comes to me and says, I want to learn implants, and says they've already spent $15,000 with implant training and they haven't started doing implants, yet there's a level of confidence that is not there. And you can't learn that from courses. You can take as many courses as you want, but if you're not somebody who's actually going to bite the bullet and start doing stuff, no course is going to teach you that. You have to be able to overcome that by taking baby steps. You need someone to show you how to take the baby steps towards doing that procedure. And the second thing, you can have somebody who's a lot of confidence, but maybe lacks self-awareness. So somebody who's super confident can go out and do some damage if they're not self-aware of their own skills, right? So those 2 things, the confidence and self-awareness, if you have those 2 things and you know the right steps, then you can do implants safely and effectively.
Interesting. Can you break down to us, what are the baby steps exactly?
So first thing, someone comes to me and says they want to learn to place implant, that they want to take the steps in doing implants, but they don't have a cone beam yet. Mm-hmm. That person, in my experience, is going to be highly unlikely to do it. The reason is because they don't know all of the variables, right? There's still always going to be that thing lingering in the back of their head, like, oh, I don't really know the anatomy, what ifs. It's all the what ifs. So if you don't have a cone beam, you really should get a cone beam at this day and age. Just get one. I mean, don't dilly-dally on it. Just get it. There's no excuses. The second thing is, okay, if they have a cone beam and they're motivated to place dental implants, but they're not comfortable with flaps yet. Like you're not comfortable with a basic flap. You have to start flapping. You're not going to do an implant if you don't know how to flap. It doesn't mean like jump into an implant surgery right away. It means that at your next extraction, do a flap. Make it a surgical extraction. Just like expose the bone a little bit. And every appointment, every patient, just do a little bit more. Your next extraction, flap a little bit. Extraction after that, flap a little bit more. Maybe use the handpiece. Just get a little bit more comfortable with all of the things that go into implant dentistry without jumping into doing the implant if you're not confident yet.
Gotcha. Interesting. And then you mentioned lacking self-awareness. What does that look like specifically?
Lacking self-awareness. So I've had some students that have trained with me and they are very excited and they just stomp their foot down on the pedal. And that could be dangerous. It could be dangerous to just kind of like go all out on your patient on your first try, on your first implant. I've had people that just put the implant drill all the way through like crazy deep. They just spin it at full force and they're already past where they need to be. And you can get into dangerous situations. If you don't have a little bit of fear, you need to have some fear, right? You need to be a little bit afraid of the negative consequences of the procedure. You can't just be no fear, let's go big or go home. And the patient's going to end up in the hospital. Okay, so you have to make sure that you give the procedure the respect that it deserves, the patient the respect that it deserves, like the proper amount of fear so that you're careful. I think that's what it comes down to, the proper amount of fear so that you're careful during the procedure and you don't hurt anybody. Confidence is great, but when it's unhinged, I don't want that person training with me.
Yeah, that's really good. I like that. For you, where do you feel like your fear starts kicking in?
I try to approach all my cases with a craftsman mindset. So what that means is each case, I'm going to approach it and do like all the details to make it come out the very best that I can, that's in my control. And everything else I have no control over. But I can control the speed of my handpiece, the movement of my hands, the care which I take for the procedure. So by approaching it with a craftsman mindset, I remove all the other stressors for me. If the patient complains later about, something, I don't care that much because I did the absolute best that I could, right? Because I use a craftsman mindset. So for me, it's not necessarily like fear because I'm ultra comfortable with the procedure and the complications. Now, if I was doing like a zygomatic implant, I would have some fear. I don't have training in that. I could hurt somebody. But the things that I'm doing, I'm generally not putting myself in a position where I'm going to hurt somebody or put somebody in danger because I've already kind of know the consequences of what I'm up to. But for somebody who's just getting into it, who's a beginner, they should have some fear because they're not familiar yet. They haven't made the 100 mistakes around the procedure.
Yeah. When would you tell them, like, you don't have to be afraid anymore, man? Like, you're doing really great.
I think if somebody's already placed 50 implants and they're turning out okay and they've restored them, it's all kind of bread and butter from then on.
Gotcha. So then what's a belief about implants that's widely accepted, but to you, you feel like, man, that's completely wrong?
Controversies. This is the one that I've been talking about forever. Every implant company, there's like 1,000 implant companies out there right now. There's a ton, right? And every single implant company says we are better than the other implants because of our surface treatment, our threads, our platform. So every single company says that they're better than the other ones. But that can't be true, right? It can't be true that every single one is better than the other one. And it's just the sales gimmick and everybody's bought into it. When we released Implant Club, we released it on the basis of simplicity, transparency, and no BSing with the customers about features. Like you need to get our thing because it's got special surface treatment. Our stuff is great. But you know what's funny? People would ask me like, what's the secret ingredient? What's the special feature? Like they want that stuff.
Yeah.
Dentists want a special feature. You want Straumann's BLX implants. I think they call their threads like lion claw design or something stupid like that. But people want that. They want to be titillated or whatever the word is.
Yeah.
They want to be sold to.
Do you think they're asking like what makes it different or what are your thoughts?
I don't know. The way that it's been asked to me, it's like, what's the special ingredient for your implants? Like BioHorizons has the laser lock, like Straumann has the lion's claws. Like, what's your thing? So I think that implants, by and large, are a commodity. Nobody really says that, but they're commodity implants that you get. You need to know the titanium grade. You need to know if that thing's going to be strong. You need to use it properly. And that's pretty much it. The titanium grade, the ubiquity of the platform, right? If you're going to get some like super niche platform that nobody uses, only that one specific company, that's going to be a pain in the butt for dentists to restore that, especially when it's not that one dentist handling the case. Maybe like 10 years later for somebody else to try to restore that. You want your implant to be strong. You want it to be easy to restore. You want it to be easy to place, like the workflow of it needs to be simple. It can't be like a kit with 1,000 parts. And you need to know what you're doing. Aside from that, like use whatever system you want, you know?
Yeah.
And I don't know, I just think it's a bunch of BS that it's been muddled from all the sales reps trying to tell you that one thing's better than the other.
Yeah, no, that's true. That's true. I like that a lot, man. That's a really good insight right there. So then if you can walk me through a case you've seen where everything looked fine on paper, but you knew it was going to go wrong. What did you see that others didn't?
So this is the thing, okay? When beginners want to start placing implants, I'll say, okay, shoot me a case. Let's talk about it. Let's get you to do it. They will always send me the case of full mouth extractions on a smoker who's also a diabetic and wants all on four and wants to do everything immediate. Like, what the hell, right?
Yeah.
How are you going to learn like that? You can't learn like that. It's craziness. So those cases, I already know things are going to go bad for you. Okay. And this is something that I see very common. After somebody starts placing implants, they start to get looser with their treatment planning protocols, kind of cavalier and accepting things that they shouldn't have accepted. That's why I'm very, very rigid about my treatment planning. But yeah, cases that are done on patients who have no posterior occlusion and you're going to be doing implants in the front, stuff's going to break, okay? Or patients that are heavy smokers or diabetics. You shouldn't be accepting all of the high-risk patients when you're just starting out. Those are things that they always go wrong. They always go badly for you. And then they're going to scare you away from like having an implant heavy practice. So you asked me what cases that I see that I knew something was going to go wrong. It's when somebody accepted that and then I'm treating the patient afterwards and I'm like, no, why did you accept this case in the first place?
Interesting. Yeah, they kind of dive in all in, right? What would you recommend? What's the perfect situation where you're like, start with this? The
perfect situations, if you have a patient who has adequate bone, right? So I have a treatment planning checklist, okay? So you're gonna have 10 millimeters of vertical height. You're gonna have at least 7 millimeters of mesiodistal space, at least 7 millimeters of buccal lingual width. You have enough space to put a tooth in there, right? You have to make sure that the patient bites down, you see you have space, and that the patient's just not a medically compromised person with stable occlusion. That's it. None of that was a mouthful, but it's a checklist. I go through the checklist, and if the patient meets that checklist criteria, do it. If they don't, follow the protocol to get them to be a candidate. So that's all stuff that we teach in our Foundations program and our Foundations of Implantology textbook. I think people get in trouble when they start to not be strict on their treatment planning protocol. If you need 7 millimeters of bone thickness and your patient has 6, you're going to be like, should I do it? And the patient's going to be like, doc, can you do it for me? I know you can do it. I mean, don't do it. Okay, that's when things start to go wrong.
Gotcha. So then, if you don't mind me asking, it's 6, right? Let's just say it's not that exact situation. And you're like, I'm not going to do it. You told us to follow the protocol.
Yes.
What does that look like?
That's a protocol that we teach. So for example, if they don't have enough buccal lingual width, if there's 6 instead of 7, then we're going to do a GBR and then see them back after 5 months. Guided bone regeneration can predictably add a couple millimeters to that and turn that non-candidate into a candidate. And then you can sleep soundly at night. If you do it and doesn't have the proper bone volume, that's when you have like all these cases on your mind that are stressing you out at home.
Interesting. Okay. I like that, man. And so you continually teach different types of protocols for that.
So our target is dentists who are starting out and want to place their first implant, or somebody who's already comfortable placing a few implants a month and wants to grow into bigger treatments like overdentures or all on 4 or GBR. So that's who we teach. And we teach protocols around that.
Gotcha.
And it's all about the protocol. You know, if you just start winging it, then too much of that stuff just lives in your mind instead of lives in your team as a protocol. If it's a protocol, it just flows. If you're winging it, then you got to think with every single patient. You got to keep track of it in your mind.
Yeah, that's true. Interesting. What would you say is the thing that they rush through and you're like, man, you should be taking the most time throughout this time?
I think that people rush through the treatment planning part of it when they're just starting out. People rush through the treatment planning because they want to do a case. They're like looking through their patient base and they see a person that needs implants. They're like, all right, I'm going to do it on them. But maybe that's not a good fit. So you need to be patient and find a case. In every practice, there are ideal patients, right? There are ideal patients, the ones that have plenty of bone and that's going to stress you out like 0%. So don't rush through finding the right candidate and treatment planning, and then block an hour. I mean, this is for a beginner, right? Block an hour on your schedule to do your implant surgery. Don't double book it. Don't get cheap. Don't try to do crown preps at the same time and crown deliveries and you're jumping around. Don't do that. Just block it. I know that's tough to do for a lot of people, blocking their time.
Yeah. Okay. Interesting. So then if I followed you for a day, or one of our listeners, right, followed you for a day, what would they notice you doing slower than anyone else?
Slower. I'd say my procedures, they get a really long block of time because I want to make sure that I get to use that craftsman mindset and give attention to every part of the procedure. Sometimes my assistants, for example, will like ask me questions about other patients while I'm seeing my patient. Like I'm doing my surgery and they'll come in and ask me questions about other patients. So sometimes, I don't know if it comes across rude, but I'll just say like, no, not now. You just got to stay focused, right? So I think they'll see a level of focus if they're shadowing me for a day. And yeah, we see a lot of different things from surgeries to prosthetics. So it's a lot of variety. So it is a lot to keep track of.
Interesting. Okay. Yeah, it is. So I know we talked about protocols. For you, what makes you walk away from a case even when you technically could do it? I know you mentioned some specifics and dimensions and like millimeters, but besides that, what's something where like, because you've done a lot, you teach a lot, but for you, even Ivan, you're like, I can do it, but I'm walking away.
I think it's really important to choose your patients wisely. So choosing patients that you want to work on, you do that partially through the prices that you set, right? If you're doing $800 implants, you're selecting for people who are going to pay $800 for an implant. So we have higher prices. We have higher prices and it selects for people who they want to invest a little bit more in their health. But also we have to filter people who aren't the right fit. For example, there's people who have sued their previous dentist. We will not see patients who have sued their previous dentist. I'm just not comfortable with seeing people who sue. Also, people that want things specifically their way. I've had patients come and give me contact information for the dental laboratories that they want to use and the specific materials that they want to use and the specific way that they want me to do their treatment. And that's really tough to do because, like I said, I follow protocols. And if I follow somebody else's protocol, I don't know how it's going to turn out. I only know my protocol. Right? I only know what works in my hands. So I can't do it a different way. And just generally patients who just don't seem like they're somebody that you can be married to in the sense of like taking care of them for a long time. The treatment that we're doing, I mean, we're following the patient for many, many years. Some patients, for example, say, hey, I saw a documentary on root canals and how root canals are going to kill me. And I need you to pull out all my teeth because, those patients, they're not a good fit. And what I'll do is I'll just kill them with kindness. I'll spend a lot of time with them and educate them and tell them about all the resources like a university or whatever. I'll spend time with them and then they walk away grateful that I did and just say, I can't help you. I'm not good enough to help you.
Gotcha.
And so turning people away is a key ingredient to success.
Interesting, man. That's really good. Really, really good advice right there. You mentioned, we'll talk about the marketing part, how you market differently with lower pricing and stuff like that and a specific price. But how do you know who sued?
You ask them. You ask them, and one of my patients recently, I did not ask, and then turns out she did. She is currently suing her dentist, and she called in and requested documentation from my office. And it always puts you on a bit on high alert when somebody's suing. It slips through the cracks, and she's a nice patient anyhow. But still, you never know.
Is that on the new patient form, or you just ask them, or how do you?
At my consultation, I have a checklist that I go through. Have you sued your previous dentist is not on that checklist, but I will add it to my checklist now.
Yeah. What's unique about that checklist in your consultation, if you don't mind me asking? Like, is there anything specific to make it easier?
Yeah. I go through a checklist that I made. It's this little software that I made that I go through. And it keeps it systematic because if you're winging your consultations, if you're just kind of, like I said, going through stuff that's living in your head, you'll miss stuff. Just like I missed asking this patient about if she sued a previous dentist. So that checklist I go through all the contraindications. So diabetes, if they have diabetes, I want to know their HbA1c. If they have had radiation therapy, I want to know what their dose to bone is, where the radiation was. I want to know if they've taken bisphosphonates. If they have, are they IV or are they oral? And how long have they been on the oral bisphosphonates? Are they taking long-term steroids? Because that also affects healing. Do they have osteoporosis? Are they smokers? So all these things I want to know ahead of time so I can put it into their consent forms and give them realistic expectations of how this might turn out.
Got you. Have you ever bent You know what I mean? If they're like, yeah, I've sued, or yeah, you know what I mean? Where there's a red flag, but you're like, but they're really cool. Or no, that's just like a strict, no,
I'm like,
maybe.
oh, they have a red flag, but I need some money.
Yeah. Yeah. Like
No,
I need money, or
no,
they're
no.
just like a great patient, or,
I have made an exception for one patient. She had some red flags, but it turns out she was going through a really hard time in her life. Her son had just passed away
Mhm.
and she was getting turned down by other dentists, and I turned her down too. And then she came back and kind of told me her whole story. And then I made an exception for her, and she's been a wonderful patient. But I won't make an exception for other people because you just never know. You're meeting them for the first time and just taking their word for it. They could be the nicest person, but if their past has shown that they are somebody who sues their healthcare providers, it's just not worth it for me. There's no amount of money that I could receive from a patient that would make me want to add stress to my life. I do treatment because I enjoy it. I do treatment as much as I like to. I'm not going to add more stress to my life.
Yeah. No,
I
that
think
makes a lot
that's
of
the
sense.
key for your listeners here is adding treatment to increase the scope of what you can do for patients and I guess your satisfaction with being a doctor and the abilities that you can do for people, but not to add monkeys on your back, right? Not
Mhm.
to add stressors because we all got enough stress in dentistry. You don't need to add more stress to it. My goal with Implant Ninja is to be able to help equip doctors to do things that feel like bread and butter to them so that placing implants feels like bread and butter, that doing overdentures feels like bread and butter, that they're increasing their production and increasing the scope of their practice without adding a ton of stress.
I like that a lot, man. So then, right now, where are you located?
We're in Stockton and Lodi, California.
Okay. How saturated would you say it's out there with people, practices doing implants?
Everybody's doing implants. Every single practice is doing implants. Even if they don't do implants, they say they're doing implants.
Yeah. Yeah. Yeah.
You know,
Interesting.
every single practice is now named family practice and implant dentistry.
Really? With that, if you don't mind me asking, what you've seen in your community, what have you heard is the lowest price for implants right now?
Honestly, I'm not sure. I don't really pay a ton of attention to that.
But you
My
know you're not the lowest price,
bucks.
right?
No, absolutely not.
Okay, so then how do you market?
We market a few different ways. Our biggest referral source is just internal, and that's
Mhm.
everybody. Everybody can do that. Internal marketing, your existing patient base already has people who are missing teeth. And so I bet you are missing opportunities with those patients. So that's the biggest source of marketing that's internal. Also, we get referrals from other doctors around the city. So we get referrals from everybody. Everybody wants to send us their patients who are very atrophic, that have dentures and that they hate their dentures and they can't do implants for. Also complications. I get a lot of complications when implants placed in a compromised position or things are broken. They want to send those cases to me. We advertise in some magazines. We got a couple billboards. I don't know if that's really effective or not, but mainly it's internal patients referring or internal doctors referring and doctors around the city sending us patients.
Gotcha. Interesting. How do you market specifically internally? Do you just ask the patient, or what do you feel like most practices are missing? Because right now you said it like, we're missing a lot, right? Kind of a thing.
Mm-hmm.
So what do you look for?
Yeah, so it's everybody who comes into their hygiene appointments that has a missing tooth needs to get educated every single time. But also those patients need to go into a list that gets automatically followed up with. I think that's where a lot of practices end up dropping the ball. Those patients just, they know they're missing a tooth and they're not going to do anything about it. The hygienist already said something and they just kind of forget about it when they walk out of the office. So they need a follow-up system to constantly let them know what the offer is and what we can do for them.
Gotcha. So everybody who's missing a tooth.
Yeah, that's the biggest opportunity, I think. There's a lot of opportunities for implants that are not capitalized on due to inefficient follow-up or inefficient education. Every single person who has a missing tooth needs to get a consultation with the guy that does implants. Yeah.
Got it. Okay. What's a mistake so far you made that changed how you practice forever?
When I first graduated, I thought I was Superman, and so I started doing all kinds of stuff. I did grafting that was beyond my experience, and it didn't turn out well. I did grafting on a young lady, I think she was like 25, and it was an aesthetic zone, and she might have been getting married as well. So all of like the things that you don't do, I did that, right? So I did some larger grafting on her, and then it went south. It just resorbed, the whole plate went away, and I had no solutions to offer. That made me really like have a reality check, right? Like I can't jump in and just do a bunch of stuff. Okay. You do need to take baby steps. That's important. Because if you don't, you're going to hit a big problem, a big complication, and then you're just going to retreat and not grow anymore because you're scared. So that was a bad outcome, but it was a blessing for me to show me how to approach growth. I turned out well for her anyway. I referred her to a periodontist. We did soft tissue grafting. We ended up doing a bridge instead of an implant, and she's happy and everything looks great. But yeah, that was a bad experience.
Interesting. Would you say that's the cost of overconfidence in implant dentistry?
That's it right there. Yep. That's it. Somebody who comes out super confident, but not having self-awareness of their own abilities and like what's going to work and like the reality of the field of medicine, right? Where you have to be cautious. That can be a problem.
Got it. So then what's something about implant dentistry that dentists don't emotionally prepare for?
If you're a general dentist, the emotional part of implant dentistry is when something is going wrong, you immediately think like, worst case solution, oh my God, I'm going to lose my license. If the implant didn't integrate, if the screw stripped, if something, you immediately just like your blood pressure goes through the roof and you think something's wrong and you're going to get sued. So I think that's something you can easily prepare for that because most of those problems, they only live in your head. Most of the complications, like worst case scenario things, they only live in your head. They won't come true. It's a very, very small percentage of the time that those things actually become that big of a problem.
Got it. So then what do you tell yourself? Like, because, I mean, it's easy to hear this now, but then when it's happening, you're like, I know for sure I'm going to get sued. I know this is going to happen, right? Kind of a thing.
Look, I've had patients that tell me, I am going to sue you. You're going to hear from our lawyer. And then I haven't heard from anybody's lawyer. It's been years. Okay. Yeah. So that's what I'm saying. Like most of the problems or like potential problems don't become real problems. Even if the patient has said, I'm going to sue you. They didn't become real problems. The way to prepare for that, that's why having a craftsman mindset is so important. If you did every step the right way to the best of your abilities in the way that you were not negligent, then you shouldn't care about anything else. Okay. If you did it the way that it was supposed to be, the best way that you could do, then who cares? Patient will sue you. The patient will probably win because that's how it is. And your malpractice insurance will pay some of that. And then your premium will go up a little bit. So what that means is think of the very, very worst case scenario. Your premium is just going to go up a little bit. Who cares, right? Your premium is just going to go up a little bit. And that's all. I've worked at a practice where the doctor was blind. She didn't tell anybody. She was abusing propofol. Obviously, she didn't tell anybody. She was abusing nitrous. Every day she would just stay and like just suck nitrous. And she was just a lunatic. And one of her patients stopped breathing while she was sedating her, and I had to run in and resuscitate her. That was like the worst example of negligence that I've ever seen. And guess what? She didn't lose her license. She's doing fine. She's still practicing. So if that kind of stuff didn't happen to her, as long as you care and you're a craftsman, you're trying to do your very best for the patient and you're trying to do your very best at every single step, I don't care what else happens.
Yeah, I like that a lot. I like how you continue to use craftsmen too, like in this arena.
That's what you can control.
Yeah.
You can control if you did your best. You can't control how it turned out, right? And I think that applies to like your whole life. You can try your best and you can feel happy with yourself for trying your best. You can't control if your business jumped to $10 million in revenue. You might not be able to directly control that right away, and you might feel like upset that your practice isn't growing, that your neighbor is at $2 million production, your other neighbor's at $5 million, and your practice is at a measly $1.2 million. You might feel bad about yourself, but you got to control the variables that you can control. And if you're bringing your best self and you're setting things up the right way, that's success, to be honest. I think that's success.
I like that, man. I like that mindset a lot. So if someone listening wants to get into implants, what should they obsess over first that most people skip?
They should obsess over learning, watching, reading, practicing, doing reps. It sounds stupid, but you can get a model and just practice over and over. You should get a model and get a kit and practice over and over and over until it becomes muscle memory. When you're in the clinic and your patient's jumping up from pain and you've got all these distractions and there's blood and there's spit, someone spit on you, there's distractions, right? So you need to have muscle memory first. Muscle memory is on the benchtop, and then you bring that into clinic, and then you're going to be ready. So that way, when you're doing your procedure, you're not thinking about what you're doing. You're just doing it.
I like that. So then what should they delay learning, even if it's super popular?
What should they delay learning? I think that right now, everyone wants to be a super GP implantologist. They want to place zygomatic implants. They want to do pterygoids. They want to do all kinds of stuff. I think that is tough to jump into. If you're in dental school and you're coming out and you're saying that I want to just jump straight into that, that is tough. I would support that as a learning exercise and foundation setting just for like experience, but not jumping into doing that right away. I know a lot of people are showing that they're successful doing that kind of stuff right off the bat, but I don't think that's going to be a safe way to operate for the first 5 years of your practice.
Gotcha. Interesting.
That's going to be a super unpopular opinion. A lot of young guys are going to be like, well, screw you, pal. I'm going to do what I want to do. Do it. I don't care. I sleep good at night.
Yeah. No, that's true. I mean, like you've experienced that already, right? So interesting. What's the fastest way to improve clinical judgment? Not just technical skill, but you would say clinical judgment.
The fastest way to improve clinical judgment, it's just to slow down. That's it. There's situations in which, like, for example, you've placed an implant and you don't like how it's placed, but you're done. And then you have patients on the schedule you need to go see. So the temptation is to just let your patient go and then pray about it at home. But fixing it right then and there is going to be so much more important than anything you can do. Giving that patient an extra 30 minutes or 20 minutes and then fixing it. You just have to be okay with being slower, with slowing down, with adding time to your procedures. So I think that's the best way to improve your judgment because you're giving yourself space to think. I think that dentistry is a really hard profession in that you can't think. Sometimes I'm just sitting there thinking and my assistants are like, Doc, what are you doing? And then they're like talking, we need to do your lab slip over here. You need to do a prescription over here. You need to do, and it's like, yo, I need to just like be quiet for a second and just think. So adding thinking into your day is going to be the best way to improve clinical judgment.
I like that, man. Especially nowadays. It feels like with everything, you know what I mean? We've been giving more so we can think less. Like we're always like on other things, scrolling, talking, business, all these things, right? And then do we ever have time to just like sit down and think? To ourselves. Interesting. I never thought about that. So then what should a dentist track or review after every implant case to actually get better?
Oh, man. You know what's been a game changer for me? Documenting my cases. So documenting your cases, taking pictures or video, it's not going to be practical for everybody, but finding a way to document as much as you can, how you did, what the torque was when you placed it, your x-ray follow-up, what protocols you followed for your patients. So documentation is going to be the best way to improve your skills because it makes you honest. I record all of my procedures like in high definition, and so I cannot hide any of my mistakes. Actually, a lot of my friends on YouTube or Instagram will point out my mistakes, and that's life, okay? But that's a way to stay real honest, and it's like objective, what is working, what is not working.
Interesting. Okay. So then, if you don't mind me asking, for your Implant Ninja, right, what do your best students do differently than everyone else?
Our best students for Implant Ninja, they'll actually finish it, right? Because a lot of people will want to start something and not finish it. So they'll finish the course and they'll do the homework assignments inside the course. So the homework assignments get you to take those baby steps. The homework assignments get you to take the leap and start doing those things that gets you comfortable with implant surgery. We'll actually get a lot of people who take the course, do the homework, and send us x-rays of their final cases. And it kind of blows my mind because when we first started, people were like, how are you going to learn implants from an online course? That sounds absurd. But here we are. Now we're getting x-rays from our students, our happy students now that they've successfully placed their first implants.
Nice, man. That's awesome. So you as a teacher, right? You've been teaching for how long? Implants?
Teaching implants since 2016.
Okay. So at the beginning of 2016, 10 years, man, that's good. At the beginning of 2016, you had a different mindset. You were thinking a specific way. It's been years now. Has anything changed in the way you teach implants?
I think we've just gotten better at hearing where the student is at and providing what they need when they need it. We've always focused on keeping things very simple, on breaking down the complex concepts and terminology and just whittling it down to the essence and then teaching from that. So I think we've always done that. I think we've just gotten better at understanding the student journey and helping them get all the way through.
Yeah. Gotcha. The student journey. I like it. So some of the final questions I want to ask you is, what's one decision a dentist is making right now that will determine whether they become great at implants or stay average?
Well, they have a lot of things on their mind. They have a lot of things to deal with. And so when it comes to certain things coast. And if you're just coasting, you're not improving. It's tough because as a dentist, you come into the office and you're busy from the moment you get there and you're busy until the moment you leave, and you don't get time to work on your actual like systems and flows, and you're just doing that stuff. Like a lot of dentists I've heard, they're doing it at night or they're doing it during their lunchtime. So it's important to actually like block time for self-improvement and improvement of flows and protocols. So it's intentionally blocking time for growth and self-improvement. If you're not blocking time for that, then you're just going to be trapped in your busyness, the busyness of your job. Even if you own a dental practice, it's a high-paying job. It's not exactly a business that's working for you because it depends on you to produce. So yeah, setting aside time for you to work on those things is important.
To improve. I like it. You normally block time, lunch, afternoon, or?
Yeah, so I don't work a conventional dental schedule. My schedule makes absolutely no sense to any dentist I've ever talked to. So yeah, I block a lot of time for myself. Yeah, I block a lot of time for myself because it's important, but it's hard, man. If you talk to any dentist, they're like, well, why aren't you in clinic more? Like whenever I say like, I'm going to go to work, they're like, oh, wait, I didn't know you were in clinic today. I'm not, but there's still work even if you're not in clinic, right? A lot of dentists, clinic equals work, non-clinic equals not work. But when you're not in clinic, you should be working on improving yourself too, so that way you could be more effective person. So setting aside time for me, for example, setting aside time to learn, to practice, to think, to purchase equipment, to work on marketing, to evaluate our flows, to evaluate our patient list, or like all the patients that need follow-up. All those things are important, and it's not going to happen during the normal 9-to-5 dental workday.
Gotcha. Interesting. So final question is, if you could install one mindset into every dentist placing implants, what would it be?
I think it comes down to what we said earlier about the craftsman mindset. If you're doing all the right things and you're doing the very best that you can, nothing else matters. The system features of the implant don't matter. The patient complaining, doesn't matter. As long as you're doing your best, you don't have to worry about much else in implant dentistry. As long as you have malpractice insurance.
As long as you have malpractice. I like that, man. Awesome. Ivan, thank you so much for being with us. It's been a pleasure. But before we say goodbye, can you tell our listeners where they can find you?
Yeah, you guys can find me on Instagram at implant_ninja and at implantninja.com, where we can help you take your next steps in your implant journey.
Awesome. Exciting stuff. So that's going to be in the show notes below. And Ivan, thank you so much for being with us. It's been a pleasure, and we'll hear from you soon.
Thanks for inviting me, Michael.